London woman, 36, dies of suspected COVID-19 after being told she is not priority. A reminder that when your condition worsens, call again. My mom had to visit the ER 3 times with increasing symptoms before they CT scanned her and realized she was in the middle of a massive stroke. They are not incorrect to say your symptoms right now don't represent a priority, but when your symptoms get worse, call emergency services again. I think younger folks are sometimes not a priority because people assume they're sick but they're younger, they'll be fine. And that's not always the case. A coworker's friend died of the flu a few months ago. She was an elementary teacher in her 30s and had a 1-year-old daughter. She went to the ER one day, sent home. Having trouble breathing, went back next day and died while they were settling her into her room. Just, bam, gone. Just the flu. She had no conditions that put her at risk. She just went down really fast. Same shit in Poland every few hours. I'm not sure how she was triaged, but if an otherwise healthy woman in her 30s isn't considered priority, it's getting bad. I think I have it. I've been waiting a week for test results. The trouble breathing can ramp up and hit you hard at specific episodes. I went to the ER and by the time the doctor saw me, the episode was over. I'm 33, traveled for work last week, not by choice, and have had a fever, shortness of breath, chest pain, a dry cough and severe fatigue since a Friday. I've had video visits with my doctor twice, who only suggested an inhaler and self-quarantine and said I couldn't get tested because of my age and typical good health. I logged into my chart after to see what he'd recorded and he neglected to write that I'd had a fever and said I was being treated for acute bacterial bronchitis. Must be nice to be a celebrity with no symptoms but still get checked anyways. I know the knee-jerk reaction may be to attack the paramedic and say they should have known better now that we have the benefit of hindsight, but I would urge people not to jump to conclusions when they don't have access to the patient's notes or their observations or anything else beyond what the newspapers tell you. It could very well be that when the paramedic saw her she was stable enough to not be a priority, but she deteriorated rapidly before anything could happen. Regardless, this is a very tragic case and unfortunately this will become more and more common as the days go on. That one was like a punch to the gut. I'm horrified at the state of things. I'm actually speechless after reading that. She really felt like a number and not a person the way the whole situation was handled. No test, no duty of care, and I'm afraid all indicative of a health service that is stressed beyond acceptable limits. Despicable, sustained cutbacks on our health service in the name of austerity. There is not enormous pressure on critical beds at the moment. It is what you might expect for a normal winter day. From today's government press briefing. https://www. com/politics/live/2020/mar/25/UK Coronavirus Live News COVID-19 PMQS Boris Johnson Parliament to close early for Easter recess. Page equals with block 5E7B94C88F081E5EDA236 AAA hashtag block 5E7B94C88F081E5EDA236 AAA. While commandeering convention a center as a field hospital. https://www. BBC. Co. UK/news/health 520184777. Either there was a tragic screw-up/miscommunication, or we are already in the triage stage. The course of this disease is that people will present with some symptoms but not clinically unwell enough to go to the hospital. Every single person that dies from this virus has a period where they are symptomatic but not compromised in a way that requires use of precious hospital resources. Rather than assume a grossly negligent paramedic assessment, the simple answer was that she was well enough to stay at home but deteriorated more than 24 hours later. London paramedics can and do leave up to 40% of patients at home with advice. Be careful what you wish for. If you demand all symptomatic patients transported during a pandemic, you will literally have zero ambulances for those actively dying that minute, nor hospital beds. Cases like this happen, especially with a viral illness, as there is no treatment until they need supported oxygenation and or mechanical ventilation. Nice to see the insane amount of judgment here without even glimpsing at the report. In an unprecedented pandemic, patients must be triaged or more will die. She had trouble breathing and was D/C with paracetamol. Fucking wow, the British press is a dumpster fire. They should confirm whether she actually had COVID-19 or not. Also, it's probably the case that for every story like this the health system is fending off 1,000 legitimately low priority calls. Well, she should have been a celebrity or a politician. I think it's time to do what China did and start setting up a lot of temporary hospitals. That's gonna happen. The odds are in favor for any given individual, but there's no guarantees. I love how somehow this is being used as an attack on socialized healthcare. It's a fucking pandemic. This is the reality of not enough infrastructure to deal with the number of critically infected. It wouldn't matter if you're a Russian oligarch with ventilators through sketchy means, or a citizen of the United States, the UK, or otherwise. Healthcare resources are being ravaged. Now consider all of the healthcare resources that will also be out of commission, lessening overall capacity of qualified caregivers, and you have increased stress. This is why lockdowns were so important, but given most are inadequate and too little too late, this is the wave of doom that we've signed up for. This was the first article I read after being told the same thing from my doctors. I'm 23. I was doing okay. I've been waiting over a week to be tested, but I've deteriorated rapidly today. I know I have pneumonia. My lungs are filled with fluid. I can form sentences but I take pauses, my coughs are trying to be productive and I don't want to stop them. But there is more fluid than there was. Antibiotics didn't do anything and the course is nearly done. There are no medical services open beyond the ER. My local ER has 28 COVID cases and everyone else, as of 3 hours ago. God knows if they have space for me. My test is tomorrow. I just need to be treated for the pneumonia and I can make it through. I can. But I've been begging for over a week to get an X-ray, to be seen, but no one will. The ER doesn't have space and every other doctor tells me to go to the ER. I fear this is going to be me in a few days. I was never one panicking about COVID, I was cautious, but I'm trying to emphasize that I am not having a panic attack. But now that I can't get medical care when I could be an easy case, I am very much worried now. And I know there's nothing I can do, so I'll stay at home, brush my dog, try to cook dinner, and cuddle my pup, and hope I wake up tomorrow. This is why we need to stay the fuck home and flatten the curve. If the infection rate's slow, we won't have situations like this where hospitals are overloaded and have to pick and choose who they help. I know I'm probably preaching to the choir, but just saying. All this focus on what are extreme statistically outliers is only fueling panic here. So if the old aren't the priority and the young aren't the priority, who is priority? They can't simply treat purely based of present symptoms, as they are bound to worsen over time with some patients. Lot of haters on here trying to blame universal health care for this. At worst the paramedic misevaluated the seriousness of the woman condition, likely is she didn't present overly serious symptoms at the time which unfortunately escalated the next day, or she had an undiagnosed condition that complicated the issue. All I am saying is UK could have responded way sooner than this herd immunity bullshit, and people can't stay at home for too long, so timing is blah blah. I clearly remember when we had 200 cases and Korea had 8,000, which seems long way over us. Where are we now? So many selfish people in this country. Fuck.